morning.
Good. Please begin your testimony. We have a 3-minute clock going on here for all testimony.
Thank you.
I'm assuming you can't see that, so we may interrupt and ask you to wrap up when we get to 3 minutes.
All right, I'll do my best. Good morning, Senator Curry, Representative Roberts, and the distinguished members of the Committee on Innovation Development, Economic Advancement, and Business. My name is Nick Murray. I'm Policy Director with Maine Policy Institute. We're a free market think tank, nonpartisan, nonprofit organization that advocates for individual liberty and economic freedom. We are testifying in opposition to LD 103 simply because the bill is unnecessary. We already know what the problem is with our childcare industry, and it is a crippling regulatory burden that stifles entrepreneurship, not to mention uncompetitive tax environment compared to our regional neighbors, New Hampshire and even Massachusetts. The real question is whether this legislature will recognize what has happened to childcare capacity over the past 15 years and how the state has contributed to the lack of capacity by piling on more and more regulations every session. So since 2008, Mainers have lost access to 48% of family-based childcare providers, and that option is on average 40 to 50% cheaper than center-based care on average. Every single county has lost at least 36% of family care providers since 2008. Waldo, York, Lincoln, Knox, and Hancock County have lost more than half of their family care providers. In my written testimony, I provide a line graph that shows the statewide numbers of both family care and center-based care. Some counties have lost 30% of all providers. That's Washington, Oxford, and Androscoggin. More than 30% of all providers in the county. That's gonna restrict supply, and it's gonna raise costs, and that's why we're here where we are today. So the governor and this legislature have refused to extend by an inch the number of children an unlicensed provider may care for. In fact, the governor waived this requirement to expand the number of children a child care provider could watch during the pandemic for reasons of health and safety, but then reinstated the rule for reasons for health and safety as well. So this is the problem. These rules are arbitrary, and so why are we reinstating something for the same reason that it was loosened? We are out of step with national norms, so that's got to be something we fix. Representative Lanigan is exactly right on that scenario, but this is the fact that costs are too high to operate a child care center and a family-based care center today. Even though capacity has risen in the last couple of years, this has been consolidated into fewer and fewer centers. And what I mean is that when you drop family care providers, you push people towards these center-based care, which are more expensive. So these rules and these regulations and taxes and all these burdens for entrepreneurs to get into the industry, it hurts low-income families the most, because these are the folks who need to spend more of their money, discretionary income, on childcare because they also need to work. So we have the situation where families are pulling out of the workforce in order to stay home and not bring in earnings just so they can have childcare. The money that the administration has thrown, the federal money in grants the administration has thrown to this problem, has not done anything to help. The issue is that we are constantly piling on more regulations, whether it's program quality, spatial requirements, education requirements, or certification for folks who work.
Wrap up in the next 15 to 20 seconds.
Glad to. So please, legislators, please stay in your lane. Get out of the way of these childcare entrepreneurs who want to give it a shot. These people want to serve their neighbors with a service that many desperately need. The rules and regulations from the state are not helping, and I think the state has a pretty dubious record of child welfare for children in its care anyway. So this is not something that the state really should be working on. This study is unnecessary. Go back in time in the last couple sessions and repeal some of these ridiculous regulations that are keeping people out of the industry. Please deem LD 103 ought not to pass. I really appreciate your time and glad to answer any questions.
Thank you. Chair recognizes Representative Smith.
Thank you, Mr. Chair. Thank you, Mr. Murray, for being here today. Wondering if you know of any studies that have been done with groups of parents and daycare providers to look at the regulations that actually are inhibiting their ability to grow, expand, or even just stay in business.
Sure. We published a report in 2018 that looked at the regulations for childcare, and like I mentioned, it's gotten worse in the last couple sessions with the program quality and things. But we did have some testimonials that we brought forward in testimony a couple sessions ago of these providers that were noting that it was raising costs for them, and that they were unable to provide. And you see this in national data too. The cost to operate a care facility is often more than what they're able to charge in order to bring in customers. So something's got to give here. But I'm glad to bring that to the work session or send that report along to folks, because this was something we compiled in 2018 to look at how these rules, staffing requirements don't lead to more health and safety, don't lead to more capacity. And so there are these things that we think might help, but they're actually hurting when we should be trusting folks who know how to run these businesses better than yourselves. With all due respect, legislators don't know how to operate a childcare business. And I think that's why I say stay in your lane, get out of the way of these folks so they can begin to serve their neighbors that are out there that need this help.
Representative Roberts.
Thank you, Mr. Chair. Thank you, Mr. Murray, for your testimony. I served on a board of a child care center for multiple years, so I think I'm in my lane here. Wondering if you've ever worked in a child care facility. You seem to have a lot of opinions around regulations and how they affect.
Yeah. I've worked. I worked for a Jewish community center for a couple of years in their summer camp program and music program. This was not in Maine, but through our work over the last 5 years on this, we've spoken to many child care providers, and I want to stress the loss of family care providers is really hurting parents. This is removing this cheaper option, and then we're consolidating the industry around center-based care, which is going to be more expensive and boxing out more of those low-income families.
Representative Sarah.
Mr. Murray, thank you for your testimony. Again, I think this is more of an observation than a question, but it points to what it's a request for how we could approach this in the work session. My observation is that your testimony isn't so much on the merits of the bill as it is on the merits of the policy that the bill proposes we study. And it strikes me that creating what the amended bill proposes would give you a venue for making your case. This committee hearing is not a venue for considering the case that you are making, because we do not have a bill in front of us to repeal the regulation you are asking us to repeal. Whereas the working group would create that forum. Am I making drawing a sound conclusion in your opinion?
Absolutely.
And would you be interested in this working group existing so that you could make the case that you're making to us today?
I don't think it's necessary to convene this working group. I think we know what the problems are, and we're seeing it today. So I don't think it's necessary. I would appreciate if it were to pass, I would appreciate someone on the committee, or maybe the scope of this study being broadened to study the costs of regulations and requirements, educational certification requirements. I mean, this should be an all-encompassing thing if we're going to do this, but I just don't think it's necessary to study this, because we've seen the effect of the regulations that have come through over the last 15 years. The proof is in the pudding, If I could request one thing from this committee, I understand that the Office of Child and Family Services only publishes the last fiscal year data on claims of abuse in childcare settings. I would urge this committee to request that DHHS post that historical data online so we can see how the effect of these program quality regulations have affected issues of health and safety. I'm pleased to see that there were no deaths and only 2 claims of abuse, none of which were from family care providers in the last year of data. But if there's a way to broaden the scope of that so we can really see what the effects of all of this has been since 2015, I think we'll see that the state itself has contributed to the loss of care, the loss of capacity, and then the heightened costs. So I think it's important for this committee to look within. But yeah, if you can extend the scope of this study, should it carry on, to look at the effect of the program quality, spatial regulations, staff education requirements in increasing costs, I think that would be a better way forward.
Representative Sarah, did you have a follow-up?
Yeah, really quick follow-up, Mr. Murray. Are you aware of a bill before the legislature in any committee that seeks to implement what you're advocating now?
I believe LD 1061. I'm not sure if it's coming towards you, but it would expand the number of children that an unlicensed provider could offer. I believe there may be some that are undrafted, but that's the one that I know of that deals with part of what I'm asking for here.
I'm going to ask us, let's stay on the topics of this bill. So Representative Callamore.
Thank you, Mr. Chair. Have you had a chance to look at the amendment?
Yes.
Okay, so I'm curious, I don't know if you remember, but I'm an early childhood education provider, so I'm very familiar with the field and how it works in centers and in family care settings and in the school districts. And I'm curious if this were to go and we were able to broaden the scope, and I like the idea actually of broadening the scope to see how regulations impact cost. I'm not sure I'm opposed to having a study, and I'm usually opposed to studies, by the way. If we included a representative on the membership who could provide that kind of expertise, and if you had a broad description of somebody who might meet that expertise that we could include as a recommendation if we were to amend it to include that.
Yeah, I'm glad to contribute, what I can to that process. I think that'd be a great thing to just get that perspective. So yeah, however I can help, should this pass, glad to. I just don't see the Children's Cabinet as being the source of a critical eye of this, right? So they've been behind the grants that have gone out to this industry and the increased regulation. So just the nexus of this study doesn't seem to have the grounding to really look at this critically and see where the state may be affecting the industry in the wrong way. I'm worried that this will just become another program, another tax, another subsidy, another mandate on businesses to fix a problem that the government created in the first place.
Representative Walker.
Mr. Murray, did you, in your first comments, did you make some distinction between licensed and unlicensed providers? And could you expand on that a bit for me and for others who may not understand the differences there?
Sure, yeah. So there are several licenses, whether it's a nursery school, a family-based care, which is usually operated out of the home, or a center-based care. Those are licensed, but there is a provision for an unlicensed provider to care for 2 children today. I believe 3 if 2 are siblings, and so that is the sort of neighborhood. Neighbor who might watch a couple kids, maybe their own or maybe someone else's. I believe those the 2 children for unlicensed are those who aren't your children if you're operating out of your home. So that's the distinction there, is raising the threshold for at the point at which a provider would need to have a license. I think that's an important aspect of this. Then you have to look at all the regulations that are subject to that family care providers and center-based care providers are subject to as well, that have contributed to the loss of licensed providers since 2008.
Seeing no other questions. Thank you. Representative Lanigan.
Mr. Murray, do you know how many businesses currently in the state of Maine, like large employers that actually have their own on-site childcare center?
Nope, not aware of those numbers.
Is there any way that we could get that for the working group?
You just ask
Sam, okay, awesome. Thank you so much.
Thank you.